Okay, so today I'd like to talk about bone augmentation or guided bone regeneration, two terms for a very similar procedure, basically just building bone in order to place implants later. So first let's talk about what you can expect after surgery. This is one of the more painful things we do in dentistry, and the pain that you feel afterwards is definitely associated with the size of the graft. If I stuff a pretty large chunk of bone in there, it's going to hurt more than if I put a small chunk of bone in there. The pain's going to be there for the first 3 days or so after surgery. Swelling's going to be similar. It's going to be for the first 3 days, although the bigger the bone graft, the more you're going to swell. Like with any procedures we discuss, if you have an increase in pain and swelling between 4 and 7 days after surgery, there's a small risk that you have a post-op infection, and if that's the case, you should call the office. As far as bleeding goes, you can expect a little bit of bleeding for the first day after the procedure, also the second day. But if it's major bleeding, please give us a call. We'll get you in. As far as bruising goes, this is a procedure you're probably going to bruise from. A bruise is going to show up anywhere between 2 and 3 days after the procedure is performed. Usually lasts up to 7 days, but sometimes if the bone graft is significant, it'll last up to 14 days. And then as far as sutures go, most of the time with these procedures, we're going to be using sutures that don't come out on their own, so you're going to need to come back to the office anywhere between 2 and 3 weeks after the procedure is performed in order to take those stitches out. So a couple of strict no-can-dos, actually more than a couple, sorry, bear with me here. Definitely do not rinse for the first 24 hours after the procedure. Any vigorous rinsing inside your mouth could disrupt the bone graft. And then after the first 24 hours, rinsing should be very, very gentle. Don't do vigorous rinsing like you normally would. Instead, just put the mouthwash inside your mouth, whether it's the prescription mouthwash, Listerine, or warm salt water. Not hot. Put that stuff in your mouth, essentially a tablespoon or so should do, and then move your head from side to side, just bathing the area in the liquid for 30 seconds or so. Okay, so back to no-can-dos. Don't spit or suck through straws. Don't touch the site for the first 7 days after the procedure. Please don't apply excess pressure or rub your face where the bone graft was performed. Movement of the bone graft during its healing phase definitely reduces the total volume of bone that we're trying to gain in the long run. Definitely do not smoke or drink alcohol for the first 3 days after the procedure. Smoking always decreases the your body's ability to heal, and therefore reduces the volume of bone we're going to gain or the quality of bone we gain in the long run. Please do not exercise for the first week after bone grafting procedures have been performed. Just be that couch potato. It's every excuse for you not to do the lawn or not to do house chores or whatever. I give you the excuse. Let's get out of that stuff. Be that couch potato that I want you to be. No hot food or hot beverages for the first 24 hours. Strictly cold. Then after the first 24 hours, you can move to warm beverages and food. Eliminate spicy foods, chips, popcorn, carbonated drinks, or acidic beverages like orange juice or grapefruit juice for at least the first 14 days after surgery. Okay, so let's talk about some things that you should be doing in order to improve the healing of your bone graft. In that first hour, we're probably going to put gauze in your mouth, gentle, firm pressure to the bone grafted site, but really only in this first 24-hour period. After that, we want no movement of the bone graft. Cold packs, use frozen peas or the cold pack we provided you. The chemical ones that we provide you in the office don't last very long, so you're going to want to go home and switch this. But apply 20 minutes on, 20 minutes off. Then for the first 24 hours to 36 hours, and then after that you can switch to a warm pack if you need to. As far as medications go, I want you to take everything that we've prescribed you with the exception of your narcotics. If you feel like you don't need pain medication, fine by me. Sometimes actually it makes patients nauseous anyways. So then what can you be doing as far as oral hygiene goes? For the first 24 hours, just steer clear. No rinsing, no brushing, anything anywhere near the surgical site. Now you can brush your teeth like you normally would, just don't touch the graft. Then after the first day or so, you can use the rinse as I described earlier. And then you can use a soft toothbrush on the adjacent teeth, but don't touch the graft. There's really no need to brush the gums or the sutures where the graft was performed. And absolutely under no circumstances should you use a water pick for the next 3 months after the graft was performed. Okay, so as far as diet goes, remember for the first 24 hours, anything you eat or drink needs to be cold, strictly cold. After that, you can move to warm stuff. Everything has to be soft, okay? We're talking cold pasta or warm pasta, slow cooked vegetables, slow cooked meat, stuff like that. That's gonna be okay. But like I mentioned earlier, chips would be the worst thing you could possibly eat, because if one of those things punctured the graft, then we'd be back to square zero, and that'd be no fun for either of us. Try to chew everything on the opposite side of where the bone graft was performed. Steer clear of any excess pressure to it. So what can you expect over the long run? Well, these bone grafts actually take quite a bit of time to heal, anywhere between 4 and 8 months depending on the size of the bone graft and the materials that we use. Now if you're lucky, we're able to place the implant at the same time the bone graft's actually performed. That should speed up your healing process by about 50% of the time. Again, I want to reiterate, don't put any external or excess pressure on the graft while it heals, because any movement or compression of the graft might shrink its overall volume, and we're looking to gain volume in order to place implants. Chances are you've got a temporary denture in place. This kind of goes along with the lines of the pressure that's applied to the graft. If I don't want you putting excess pressure with your hand, I definitely don't want excess pressure to be applied from the actual denture itself. So do your due diligence to make sure that if you notice this thing is pushing somewhere that it shouldn't, call me or call your general dentist so that we can adjust it so no pressure is going to be applied to your graft. So after you've healed for the time frame that we think you need, anywhere between 4 and 8 months, we're going to bring you back in and we'll take a 3-dimensional x-ray of the bone to make sure that you've gained the volume we require for implants. And most of the time, no problem. As long as the healing goes the way that it should, which hopefully based on all the stuff that I've just given you today is the case, then we should have no problem placing implants after the bone graft's performed. Okay, so that concludes this video. Hopefully I've given you information and at least maybe some peace of mind about what you should be expecting, stuff you shouldn't do, and then stuff you should do in order to make this bone graft as successful as possible.